Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on healthcare providers, services, and programs that we have available that I think will be of interest to you and your family. I've got a great guest on my show today, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Lyanna LaFredo, pediatrician here at KRMC. Thanks for being on the show.
You're welcome, Jamie.
So I'm excited to chat with you a little bit more because I know that you're fairly new to King. You've been here a couple years now, right?
Yeah, 2 years.
2 years. And where were you before that?
I was practicing in South Carolina.
Oh,
I was
okay.
there for 3 years.
Okay.
And then before that, I finished my residency in Buffalo, New York.
Okay,
Yeah.
very good. So have you always wanted to be a pediatrician, or how did you decide that?
Yeah, I've always wanted to be a pediatrician. I knew I was interested in science and the workings of the human body, so I knew I wanted to be a doctor. And then I love kids, and that's why I wanted to be a pediatrician. I
Very
just,
good.
it's fun because it's not like going to work, because it's you have to be happy all the time and be playful, because that's how you have to be dealing with kids.
To relate with them.
Yeah, and that's
They'll
fun.
put their fears aside, because I'm sure with most kids it's like, I don't want to go to the doctor.
Yeah, so we try to make it as fun for them as possible so they're not scared.
Very good.
Yeah.
Well, I know you just moved because your office was over on Eastern, and there may be folks who don't know yet that you've moved, although I know you sent a letter out to all your patients. But so your offices are here in the Medical Professional Center now, Suite 204, is
Yes,
that right?
Suite 204.
Very good. It's the second floor. They just take the elevator up in Suite 204. Now, did your phone number stay the same?
It's still the same.
Okay,
Yeah.
so that won't change. And just so we'll start right away to let people know, if they, after the show, want to call and make an appointment, they can actually go to our website, the KRMC.com. I don't know if you even know this, and under Physician Directory, they can look you up under LaFredo or under Pediatrics, and it has your picture and a little bio about you and all your contact information, so they can call or go there and then get your
And then they
phone
can
number.
call, yeah.
Make an appointment.
Call and
Very
make an
good.
appointment.
So you're busy. I know we only have 2 pediatricians in town, and we have other nurse practitioners and stuff, but
Yeah.
for a pediatrician, it's you.
Yes, I have been busy, and that's why recently we hired a new, like a pediatric nurse practitioner to help me out.
Good. That's right. I forgot about that. And
Because we've been having problems with, patients having to wait too long to be seen for well checkups, and so with Simone, that's our new pediatric nurse practitioner, we can see them sooner.
so she can take care of like just the regular yearly checkups, physicals, those kind of things. And
Yes, and even office visits, like for sick kids, she can see them.
Very good. And so she's almost brand new with you, right? Just a few
Just
weeks?
a few months.
Or a few months.
Yeah,
Okay,
yeah.
very good, very good. So pediatrics, I mean, and obviously it's taking care of kids, but what all does that encompass? I mean, it's supposed to be well and sick, right?
Well and sick.
And you see them in the hospital too?
I see them at the hospital, so I see them from birth to age 18.
Okay.
Sometimes some of my patients in the past who've gone past 18, they still didn't want to move on to see
they've
an
got
adult
that good
doctor.
a
I see them
relationship.
until they're 21. So,
I'm not legal yet. I can still see my pediatrician.
yeah. So
Well, that's good. That says a lot about you, though, that they've built that relationship with you and want to maintain that. So that's good.
yeah.
Now, we were talking before the show about that you do the yearly checkups, and also they can roll their sports physical into that as well.
Yes, if they come in for their well visits, their checkups, we can do they can bring their forms in, and we can do the whole physical. That way, they don't have to come back to do, for a separate visit to do the sports physical.
So that's good.
Yeah, so
Saves
it's
a
more
little money.
convenient.
Sure.
Mhm.
Yeah,
And
convenient,
it's convenient for them.
So when you do a physical, and this is something else we chatted about earlier, someone comes in, and it's once a year, you want to make sure your child's healthy. And then what else do you check for at that point?
Well visits they're also like preventative visits, and so when they come in, we make sure, we check how they're growing. So we check their weights, their heights, and we check their development to make sure that they're on track. This is more important for like younger kids, like the infants, because they're still developing. That's usually the age, when they're under a year. That's the age when they're really developing fast. There's so many changes happening, and you want to make sure that they're on track. So we check that when they come in for their visits.
So there's kind of benchmarks for the different age, whether it's 6 months or a year or 18 months.
Yes, that's why if they're a little bit delayed with their milestones, we can catch it early, and then we can recommend like things that they can do, like activities that they can do with their kids to help with their development. And if that's not helping, then we might have to refer them to therapists.
Okay. And we have some great pediatric therapists now here at KRMC
Yes,
too.
we do.
So that's good.
Yeah.
They can help them with the physical, and I think Katie Brown now is even doing some of the hearing for kids too, or working on that.
She says she sees kids from a year to older.
Well, yeah, I would think before then it'd be a little difficult for testing and finding exactly where the issues are under a year, right? So when they come in, and then that's when you check to make sure they've got all their shots up to date, their immunizations and things like that.
Yeah, because it's a preventative visit, so we talk to them about things that would prevent disease and prevent prevent harm. So that's why vaccines are part of it, so that they'll be protected against diseases, especially now that we are seeing outbreaks of the whooping cough in a lot of states here in the U.S.
Right. You're saying that so far you haven't had patients yourself that have had whooping cough. Just, I think they're talking about in the state.
In the state of
overall.
Arizona, yes, we are seeing cases of the whooping cough.
And it's sad because those are illnesses that are preventative with their shots. And
it's also, it's not, the kids who are more vulnerable are the kids who are younger than a year, and even kids who are younger than 2 months, kids not old enough to get shots.
are susceptible to the disease.
And they get sicker. They're the ones who usually end up in the hospital. Kids who are less than a year, if they get the whooping cough, they don't get the usual presentation of whooping cough.
Yeah.
Sometimes they just stop breathing, and that's the only presentation.
Wow.
So it's really scary for the babies.
That is very scary. Oh my gosh. Well, and I would think, and so someone might think, well, they got it because they were too young to get the shot, but if the older kids had gotten their shots, they wouldn't have gotten sick and then shared it, right? Because it's an infectious disease.
The recommendation now is that people who are around the baby would have to be vaccinated as well, so that they can, they don't catch it and they don't
pass it
on to the baby.
What other kind of illnesses are there that a baby maybe would be susceptible to, but wouldn't get it as long as the people around them have had their shots?
Well, the whooping cough is pretty much every. But the whooping cough is the most important because it's very contagious, and sometimes a lot of people who are sick with it don't really realize that they're sick with it until, because usually really you start with just like a regular cold, and then it doesn't get better, and then before you realize it, you've been coughing for months, or like a month, or more than a month. So for adults, that's the usual presentation. So a lot of a lot of adults will have it, not know that they have it, and so they can spread it to their.
But now, wouldn't they have gotten the shots? Like if they've had their tetanus shot, for instance, the whooping cough is in.
If they got the tetanus shot with the whooping cough, like that combination, then they will, they would have been protected.
Okay.
there are, sometimes some of them will just get the plain tetanus shot without the whooping cough.
Like
so
if they stepped on a rusty nail or whatever in their emergency room, they just give them the regular
tetanus shot. So they have to find out and make sure that they get that combination shot with the tetanus and the whooping cough.
Okay. Well, that's good to know, because people may not even realize. They may just think they've been immunized and have not.
Mm-hmm. And the effectivity also wanes in time, so they have to make sure that, if it's been 10 years since their last vaccination, then they need to be vaccinated again.
That just dawned on me now you're saying that. I tell people I learn something myself every time I do this show, because I think I've had the tetanus shot like in the ER when I broke my ankle, for instance, but I don't think I had the DPT part of it.
Oh.
So I probably need to get a new shot myself.
Yeah, just have to check and make sure that you got the... Because I think now, it's recently that they've started recommending that if you go to the ER and got a tetanus shot, it has to come with that combination because of this problem we're having with... it's almost like an epidemic now of
it's coming
whooping
back.
cough. Yeah.
And it's sad because that's one of them that was almost gone, right? I mean, you hardly ever heard of it for a long time, and now it's rearing its ugly head again. What about the others, like measles and mumps? Are those kind of coming back too, or?
We are seeing more cases of the measles, and that's because of the waning vaccination rates. People are afraid of like possibly getting autism from
I've heard that
from the measles vaccine, but that's a lot of studies have proven that that's not really true. Because and it all started with this one study that was done in the UK, stating a relationship between autism and the MMR vaccine, but none of the other scientists have replicated that study. And so in the UK, in the UK, they are seeing they're having a measles epidemic right now. Many people, because they're afraid that their kid is going to end up with autism if they got the shot. So a lot of people didn't get the MMR vaccine, and so they're having an epidemic of measles there. And they're still not seeing a decline in the rate of autism. It's still rising. So there's no relationship between
them getting a shot or not. And that's sad too, because I know that, well, when I was a kid, they didn't have the vaccines for measles, mumps, and chickenpox, so we got it all. In fact, I remember my mom, encouraging us to go play with friends who had it, because she'd want us to get it while we were young. But then, if you're too young, my brother, I think, was like 8 months old when all the rest of us got sick, and he got it. But then, 4 or 5 years later, he got them all again when he went to school. So, so I don't know if that's part of it, but we're going to take a commercial break, and then we can talk a little bit more about that and some other things related to pediatrics and Kingman.
Okay.
So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Lyanna LaFredo, pediatrician here at KRMC. Thanks again for being on the show.
You're welcome.
We always learn new things, and we were talking before the break about the kind of an outbreak we're starting to see again with the whole measles, mumps coming back, because people have been concerned about the vaccine and that it might cause autism. But there hasn't been a lot of scientific proof for that now.
And there are a lot of studies since that have shown that there's no relationship between autism and vaccines.
So the most important thing for parents to realize is that the immunizations are safe, and it's going to prevent, because the side effects of those diseases can be life-altering, right? Long-term effects. I mean, measles and mumps and polio, I mean, you can be crippled for life.
Yes. So far, we haven't seen any polio, like reemergence of polio here in the country. In other countries, they are seeing a reemergence of polio, and that really is a devastating disease to have.
Well,
Yeah.
and the measles, I know, can affect your vision, your eyesight, because you have the high temps.
And you can also have, like, if you get the full-blown measles infection, it can also cause neurologic complications. Yeah.
Wow, so nothing to mess with. It's
Mhm.
not worth the risk. I don't think personally, myself anyway. So you see kids all the way through till we talked about that earlier, till they're 18 or 21, whenever they decide to cut the tie.
Yeah.
Obviously, it probably helps if they have built a relationship with you early when they're younger, right? 'Cause
Yes, usually they're more comfortable with you if you've seen them since they were little, and you've established a relationship with them. They're more open. So when they come in for their 11, 12, like adolescent visits, I sometimes start spending time with them, like alone with the patient.
Oh, I was going to ask you that. So you kind of like shoo mom out. So
That way, because a lot of teenagers there are a lot of issues that they're uncomfortable
talking in front of parents.
Yeah, and this could be anything. Maybe they're concerned about their like their acne, but are embarrassed about it.
Right.
They don't want to bring it up, and just things like that they're
The
more comfortable
changes
talking.
in their bodies
Yeah.
and what's going on. Yeah, it is
Yes.
can be embarrassing to talk in front of mom or dad about it. And
So these are the things we talk about when it's just when they come in for their adolescent visits, just like a one-on-one talk with them.
Yeah, that's good, because it is, and then they've got that relationship with you, so then if problems come up or they have some decisions they want to make, they can feel comfortable talking to you about that.
Yes.
That's a pretty good thing.
Yes.
And like you said, most of those yearly checkups are preventative to help catch things early. I'm sure whether it's obesity and encouraging them for exercise or
Yeah.
eating healthier, kind of that's an ongoing challenge in our community, in our country,
Yes.
more and more now, not just here in Kingman. Then we were going to talk a little bit too about the other types of illnesses that you see. I know we're in the summer months right now, so everybody's a little bit healthier, but school's starting soon, and it's like once school starts, everybody gets around each other and the germs come in.
Yeah, and then we start getting busy again, busier at the clinic.
Okay,
Yeah.
and what kind of illnesses do you see more of in the winter?
In the winter time, we usually have like respiratory infections. We see a lot of RSV, and of course it's flu season, so we see a lot of flu cases.
Now, can kids get a flu shot?
Yes,
Okay.
as early as 6 months, they
Oh.
can start getting their flu vaccine.
Okay.
And for kids who are younger than 6 months, it's the same thing with the whooping cough. We encourage parents or people around them to get the flu shot so they don't give it to their babies.
Until they're old enough to have an immune system.
Mhm.
Because that's part of it. We started to talk about that before the break, about when there's a certain age, when they're under that age, when they don't.
Their immune system isn't developed yet, so
Right, so they can,
respond very well to
the vaccines.
vaccines.
Okay. And then, that's what I started to say, and I don't know if this was an old wives' tale, my mother's old wives' tale, if it was true, but my brother was, maybe he was only 6 months, but he got the measles and mumps when my older brothers and I brought it home, and then a couple of years later when he started school, he got them again, because he hadn't got that immune system. I guess he was too young. So, lucky guy, got it twice. So you mentioned earlier something about the acuity of the shots, of the immunizations. So, like, they kind of lose their strength after a while. We have to have it done again on some of the shots?
in some
Right?
of the shots, yes, there's what we call waning immunity.
Okay.
So that's why the booster shots are important. And that's true with the whooping cough, like we talked
Okay.
earlier, about how you'd need a booster shot after 10 years.
Okay.
And same thing with, there's a meningitis shot that we give to teenagers,
Okay.
and they would need another booster in about 5 years after that.
Okay, so
because-
early 20s type of thing? Or-
Mhm. Usually they get it when they're about 11 or 12.
Oh, okay.
And
So
then before they go to college, they get it
Okay.
again.
So meningitis, I mean, that's another scary illness, and guess I didn't realize that they actually have a shot for that
Yes,
now.
that's one of the things that that kids get before they go to college. They need a meningitis shot because that's usually when a lot of teenagers actually die from it, because they could get sick. They could start getting sick, and within 24 hours they'd be. And these are like stories you'd hear in in the newspaper about like kids being found in their dorm room sick and not breathing. Yeah.
Wow. So that's really scary and important. And is that one highly infectious as well, meningitis?
When you're in close contact with the person who has it, then
So
you
like
catch it. And
roommates
the
or boyfriend,
roommates,
girlfriend kind of thing? Wow.
So that's why it's important for college kids, because they live in dorms,
Right.
and they're in close contact with each other.
Yeah.
So
Okay. So what other shots would you need a booster, like the measles shots?
the measles, yep. You get the first dose when you're a year old, and then you get a second dose when you're 4.
Okay.
And then the same thing with the chickenpox vaccine.
Okay.
You get a shot when you're a year old, and then you get another one when you're about 4.
Okay. But once you've had that series, you're good. You don't need it again as an adult later, maybe?
No. So
No?
far, they
So
have.
far they're saying, yeah.
Yeah.
Well, I was just curious because it seemed I'd heard something about there was rumors, and again, it's like we've talked about with the scare of the immunizations causing autism, that sometimes there's rumor mills get started and they put out false stories. But there's something I'd heard about people saying measles shots that you could get it again as an adult, that like the shots weren't working as well. But
No, we haven't. There's no recommendation for getting
Okay.
a measles vaccine when you're older. You might, for every vaccine, there is that chance of waning immunity. So sometimes you can still get sick even if after you got the shot, but you won't be as sick.
as sick. Yeah.
You'd have some you'd have some antibodies against it to fight off the infection. So
Helps your body
you
fight
might
it.
get sick, but you won't be as sick as
Okay.
if you didn't get the vaccine.
That's good to know. So a lot of times then, I know that like our nurse practitioners a lot of times see patients out in their offices, but then when they come to the hospital, if the child needs to come to the hospital, you'll be the doctor that
Yes,
sees them
I
usually?
see the patients who are admitted, and the newborn babies who
Okay.
get delivered.
That's fun.
So I see them in the hospital.
Very good.
Yeah.
Okay. Well, we're blessed to have you, and your husband is here too. And so what are the fun things have you discovered about Kingman?
Well, we like doing outdoor stuff, so we've been, we've gone hiking up in the Hualapai.
that's a great
We like
place.
mountain biking, so even just like out back, like in the BLM lands, we go out there and ride our bikes.
Very good.
So that's fun.
Yeah, there's plenty of
Yeah.
outdoor activities here to do. Lots of good hiking. And then have you done any of the Supai or Grand Canyon hikes yet?
Not yet.
That's some trading from what I understand. I haven't done it either,
No,
but
not yet. But
I know a few people who have. But
probably in the future. We've gone mountain biking in Williams
Oh,
because they have a lot of like good trails there.
good. Yeah, they do.
So, Yeah.
Yeah, and then, like I said, the Hualapais are always fun. My grandkids are here recently, and we were up there, did a few hikes, so
Yeah.
it's always good. So, did you do that kind of stuff back in South Carolina? Is that where
Yes. Yeah. We did. Because we love to, ride our bikes, and so we actually went to. I had a list of all the state parks
Oh.
with the trails, and we tried to visit each and every
Oh, very good.
each and every one of them. So that was fun.
So, have you started that in Arizona now?
Yeah, we've tried with a few,
Uh-huh.
like a few parks. We haven't gone. I haven't been able to really.
Well, you've been pretty busy.
Yeah, I've been busy,
We're
so.
keeping your nose to the grindstone. Maybe having Simone here will help give you a little bit
Yeah.
more of a break, so you can. That we talked about that briefly in the first segment about Simone. And what's her last name? Urbach. And so she's a nurse practitioner.
She's a pediatric nurse practitioner. She graduated from Columbia University, New York.
Oh, very good.
Yeah.
So they
So
can see
she's-
either one of you in the office.
Yeah.
Well, that's super. Well, thank you for being on the show. Again, I learned something new today, and I appreciate that.
Thank you
And-
for having me.
Good. Well, and I hope you all learned something today, too. And we'll look forward to seeing you next week when I'll have another great guest on the program.